Today we're doing an introductory scanning video with Cerec's Omnicam. So with most restorations, when you first open, you go through setup and decide what restoration you're doing, and then when you come to the acquisition area, we like to add before we start an extra catalog called BioCopy Upper. Even if we're not doing the BioCopy function, it's nice to have a before scan to be able to reference what the tooth was like before it was prepped. We've started here with the buccal bite scan. A lot of times this is before putting in an isolite or some other isolation system because you need the patient to be in occlusion. The goal of this scan is to scan the gingiva, the upper and lower dentition, with enough recognition that it will match up the upper and lower scans. You'll see here that the assistant is highlighting areas surrounding the scan to cut out and trim any excess or distortion. We'll do this at each step along the way, but you can also defer and trim your scan in the model stage. Also, if there's not much in the way of artifact or distortion, you don't necessarily have to trim and clean things up. The next scan we go to is the lower jaw. When scanning, it's easiest to start in the occlusal of the premolars or some other easily recognizable area. You'll hear a difference in pitch and tone for the music playing or the sound effect given, depending on whether the scan is continuing to stitch or whether it's gotten off. Here we're going along the occlusal, and then we're going to pan to the buccal and the lingual. You can see a live shot on the left of what's stitching together in the scan or on the model on the right. It's easiest to scan teeth that are dry and that have good isolation. Here we roll to the lingual, and again on the right you'll see a preview of the areas that haven't filled in. They look see-through or blue. And as you fill in and get all of the images stitched in that area, you'll have a complete scan. Sometimes you'll pick up a little bit of excess like gloves, and it'll stitch out. The goal here is to not let the tongue or the cheek or your glove be picked up in contact with any of the teeth. And again, we're cutting away some of the extra by lassoing it and using the cut function on the right. A lot of times proposals are better because it's reading the adjacent teeth when you've cleaned the scans up. So I recommend doing this if you have the time and ability. The next scan we're going to do is the upper scan. Again, starting with the tooth that's planned for restoration today that had some fracture of porcelain and metal, and we're filling in all the zones. Sometimes restorations that are full gold or otherwise very shiny are hard to pick up. You'll see areas where there's a lot of shine that sometimes you need to go at a different angle to have the light reflect differently so that it'll fill in and pick it up. If your sound effect changes and you're not actively scanning and you're having trouble getting back to a common area, sometimes it's easiest to come back to the occlusal of those premolars or the area that you started where it's a highly recognizable area. The goals of the opposing, which in this case was the lower jaw, is to get a good scan on the buccal up to the gingiva so it can stitch with the buccal bite, and then have the teeth that are in occlusion very clear and defined so we can see and plan for occlusion. The upper jaw here, you'll see we drug over really quickly and copied into the BioCopy folder. Next, we go back to our upper jaw and we cut out the tooth that we're going to prepare today. After this tooth has been cut out and is missing, the clinician then goes and prepares the tooth for its restoration. We'll fast forward ahead here And now when it's time to take the impression of our preparation, we come back to this upper folder where we had cut out the prepared tooth. And you'll see the amalgam buildup has not been removed, but it's a little bit roughened up, so it's a little easier to scan than some of the shinier metals. And you'll see here as we go around, we're filling in all of the remaining areas. The nice part about setting your scan up for this is when it comes time to take your final impression, this process is rather fast, and at this point we want to be a little bit quicker so that we can design and get the restoration milling so the patient doesn't wait as much. At this point we're going around at all angles to make sure we have the adjacent contact so that we can make our interproximal contact appropriately and that all of our margins are clear and defined. When scanning, you want to try to not hover over an area for too long because sometimes it will pick up a lot of different images and cause a little bit of distortion or a little bit of ghosting or fogging. Here we skipped ahead as well. When we go to our next step, sometimes that will take a decent amount of time to load, and the first thing that it wants you to do with your scans is line it up on the model axis. In another video where we talk about design, we'll go into detail on this, but you can see at this stage that it didn't stitch out all of the areas that we wanted it to. From our preparation scan, we still had some glove and gingiva showing. So at the bottom we clicked on Edit Model, came in and used the cut function to cut away some of the excess that was showing through. Hopefully this has been a helpful video on acquisition and using the Omnicam. At this stage we would move on to the design portion of this restoration, and in other video segments that we've done we have an analysis of preparation as well as details on how to design a restoration like this one.